So the Institute of Economic Affairs is a think tank that promotes debate and dialogue on public policy issues. And we are pleased to invite you this morning for yet another webinar series. I know we've had a couple of webinar series this week. I think this is the third one. And so today we are launching our Citizen Alternative Budget 2021-2022. So this Citizen Alternative Budget, the highlights will be shared actually by my two colleagues, Raphael Moya, who is the Programs Officer in the Public Finance Management Program. So it will take about 20 minutes, as you can see from the program. And then thereafter, Dharmi Jatani, who also works in the Public Finance Management Program, will share highlights of the latter parts of the Citizen Alternative Budget. Now, the Citizen Alternative Budget is actually a memo that puts together information that we gather in terms of budget proposals from different stakeholders. So it's actually an output of pre-budget hearings that we held on the 27th and 28th of January. Now, what happens every year, for now almost 20 years, we usually invite different stakeholders, both from the private sector, what we refer to as a corporate sector. And in this year, we had somebody from the manufacturing sector, CAM, Kenya Association of Manufacturers. We also had a representative from the financial sector and others from the corporate sector. So we usually invite somebody from the stakeholders from the corporate sectors, as well as stakeholders from the what we call the social sector. So this for this year we had somebody from Tegemeo Institute that presented or made submissions related to agricultural sector. We also had some representation from WASH, the WASH sector, water and sanitation. We had something on health and education. And we've actually listed all the people who made some contribution to the Citizen Alternative Budget on the last page of the memo. Now, once we receive these submissions, these different proposals, often the proposals would be either expenditure related or tax related. Sometimes we also have proposals that are of regulatory nature. So we usually synthesize them internally, based also on a review of the budget policy statement. So we look at all those collectively and try to just situate various issues in terms of the viability of some of the things that have been mentioned and whether they're in line with the national priorities and the like. So that process culminates into production of the Citizen Alternative Budget. Now, this memo is what we use to engage with the National Treasury. So it was submitted actually to the National Treasury in the first week of March. And the idea is basically to use this as a way of influencing the budget. And we know that the 2021-2022 budget was actually tabled last week on Friday. So the idea of this is just to take you through some of the proposals, and then we'll actually, as we'll be analyzing the budget in the few coming days, we'll check the extent to which some of the proposals that we've shared with Treasury in March, the extent to which some of those proposals were actually captured in the 2021-2022 budget estimates. So without further ado, I will invite Raphael to kick us off And Raphael will take the first part of the, will highlight some of the budget proposals, the first part of the memo, and then thereafter will immediately is done, Darmi will go ahead and present the latter part of the proposals. Raphael?
Okay. Thank you, John. And I think you have done a bit of justice in trying to make sure that what citizen alternative budget is all about. You have actually captured most of the issues, but most important, the launch is about trying to give an idea of some of the proposals that were shared by the National Treasury, but also to make sure that we are able to synthesize the estimates of expenditure and see as to whether most of the proposals that we shared with the National Treasury are captured in the estimates of expenditure. Now, without further ado, what I'll do is that I'll just quickly, we are going to give just some highlights of what is contained in the alternative budget. And the outline is as you can see in the screen. We will quickly share the state of play of the budget process, and then we have a quick interrogation of the budget framework for 2021, but also 2021, 2022. And then thereafter, my colleague Dalmi will just give a quick highlight of some of the proposals that we shared with the National Treasury, particularly in the agriculture sector, education, health, and wash sector, and then some quick taxation proposals, and then we give a quick conclusion. Now, let me just share a quick status of the budget process, and the reason why we normally share the alternative budget. The formulation of the budget culminates with the issuance of circular by the cabinet secretary, and each sector start preparing their budget. And if I remember very well, in the month of September last year, all the sectors prepared their sector report, and they held sector hearings at Kenya International Conference Center, and various stakeholders were invited so that they are able to give their views. So that's one of the avenues where stakeholders can be able to share views on the budget. Out of the sector reports, I think the National Treasury now prepare the budget outlook paper, which again culminates into the budget policy statement, which is tabled in the month of March, and it was tabled in the month of March this year. Thereafter, the division of revenue bill, again, it is tabled in Parliament, and again this year it was tabled in the month of March. And I remember in the month of April this year, toward the end, the president accented to the division of revenue bill. After that, the executive estimates of revenue and expenditure are read in Parliament. I remember they were read on Thursday, I think 29th, during the special sitting, and this is in line with the article 221, which stipulates that at least 2 months before the end of the financial year, the cabinet secretary have to table the estimates of revenue and expenditure. And then the budget and appropriation committee and departmental committees in the month of May, because of trying to get views from different stakeholders, and with a view of trying to approve the estimates of expenditure, then they are requested to hold public hearings. Most of the public, I think this year there will be a change, because they used to visit a number of counties. I remember in the year 2015 they visited more than 17 counties, collecting views on the estimates of expenditure. But I believe this year they will be able to do it virtually. Now, to sum it up in terms of budget, is that the Cabinet Secretary of Finance and the National Treasury in the month of June is expected actually to outline the taxation proposals, so that and the reason why most of the time the taxation measures are read in the month of June is to align within the East African community. And this is the time where we actually be able to synthesize the taxation measures to see to what extent the expenditure side will be financed in terms of making sure that the budget is in line. Now, trying to interrogate the budget environment for the year 2020-2021 is that prior to COVID, that is last year in the month of March, the economic growth in Kenya was moderately doing very well at around 5.4%, and this state of this stable and healthy growth supported some issues to do with trying to reduce poverty and inequality. And coming back to the issue of now implementing the budget 2020 and 2021 against a background of contracting global economic occasioned by COVID-19 pandemic brought some issues, and I'll be showing in the next figure how the effects of COVID contracted the economic growth in the country. And the pandemic, of course, prompted government to put in place containment measures, which globally affected most countries, and it also affected and disrupted business and livelihood. And one of the things that happens because of those disruptions is that there was disruption in supply chains in coming into the country, decline in diaspora remittances, poor performance in the financial markets, and of course there was a depreciation in Kenya shilling against the major currencies. Now, trying to interrogate the budget, the economic growth, is that what I'm sharing as a slide is that it shows the economic growth from the year 2018, 2019, and 2020. And what you see, for example, in the year 2018, the economic growth was around 6.2%, 2019 5.4%. But looking at the year 2020, and what we have done is that what we have analyzed, this is based on calendar years. The quarters are based on calendar years. That is from the month of January up to December. Coming to the year 2020, the first quarter, I think we are doing very well. But looking at the second quarter, that is from the month of April up to June, because of the containment measures, then the economy contracted to around 5.5%. And then in the third quarter it peaked because of ease of some of the containment measures. And what we can read from this table is that in the year, the sector that we are the drivers of the economy was primarily the agriculture sector, doing at 6.9%, followed by the manufacturing sector at 4.2%. But the service sector contracted up to minus 11%. So generally, that is the in terms of economic growth and trying to reflect on the performance of the economy. That was the trend for the year 2020. Now, going to the expenditure side, and as per the budget policy statement, is that up to December 2020, the total expenditure, including net reading, was around 1.1 trillion, and this comprised of recurrent expenditure, which was around 798, development expenditure of to around 262 billion, and then transfer to the county government of around 129. And one of the things that we have to mention is that the implementation of the budget 2020-2021, as indicated in the budget policy statement, was hampered by revenue shortfall for the obvious reasons that I've mentioned before. And the revenue shortfall for the government, of course, it was generally due to the measures that were implemented in the month of April. Now, the budget for the financial year 2021-2022 is that it's estimated, the expenditure is estimated, because the estimates of expenditure are out at 3.6 3.6 trillion compared with the one for the previous year 2021, which was around 3.5. And what it tells us is that the amount of allocation toward expenditure to the government side is actually increasing. And generally, when you're talking about 3.6, and this is something that IEA will be working from next week, trying to analyze the numbers, and then we'll be able to hold a forum just to try and come up with a physical outlook showing exactly how much is going to the executive, both development and recurrent expenditure, looking at the judiciary expenditure, the parliamentary, the CFS, all those things we will be able to share in the coming 2 weeks. And some of the things that we have noted is that the government need to maintain, as stated in the summary and of course in the budget policy statement, to maintain the austerity measures for focusing on spending on priority areas. And here we are talking about taking measures on trying to have some reductions in government spending, and it's either it can also increase in tax revenue, or it can be both. And these are harsh steps taken by perhaps the government, because one of the intentions that when you're taking the austerity measures is to try and lower budget deficits and avoid debt crisis. The other aspect is, of course, trying to maintain debt sustainability levels, and we know the situation right now. And the other aspect that we think it is critical is trying to review the programs and policies to align them to the emerging realities of the pandemic, taking cognizance of the unfavorable macroeconomic conditions which I've just shared in the table. And then talking about economic stimulus program, now that we are trying to come up with the numbers, would be critical in trying to catalyze economic activities, and then this will be able to provide livelihood for Kenyans and enable government to recover from the adverse effects of the pandemic. Now, on the revenue side, and looking again at the budget policy statement for the year 2021, is that if you look at the total revenue collection up to December 2020, and this include appropriation in aid. These are services or transactions within ministries, is estimated to be around 801 billion against a target of 907 billion. And the reduction in tax collection, we note I think two things. One is the underperformance of the main of the main tax heads, and one of the tax head is the PAYE, and we know what happened to PAYE is that the personal income tax top rate was reduced from 30% to 25%, and there was also reduction in VAT rates from 16% to 14%, and corporate income tax was also reduced from again 30% to 25%. And then there was the aspect of restrictions that were put in place across borders, and therefore this prevented a smooth flow of cargo into the country, and therefore in terms of duty correction, I think it went down. And then disruption, of course, in terms of global supply chains, that also affected in terms of import custom duty and everything. So in terms of revenue, I think those are some of the we can be able to attribute reduction of revenue to those key points. Now, in terms of the targets of revenue correction for this financial year, as indicated in the budget policy statement again, and even in the summary estimate, is estimated to be at around 2.038 billion, and this is inclusive of appropriation in aid. So I'll stop there and then invite my colleague Dalmi to just share some quick proposals on the expenditure side.
Thank you, Raphael, for the first part of the presentation. As introduced earlier by John, my name is Daphne Chetani, and I work under the Public Finance Management Program at the Institute of Economic Affairs. I'll be taking you through the second part of this presentation that will highlight some of the proposals that IEA received from other organizations and submitted them together with our own proposals to the Treasury. Okay, so the first sector that we're looking at is the agriculture sector. So the first proposal in the agriculture sector was with regards to research and development. And there is usually a recommendation of allocation of 2% of GDP for purposes of research and development. But we've seen over the years that that recommendation has fallen below 1%. So the recommendation in this year's budget is to match up that allocation to research and development to be 2% or higher. The importance of research and development in especially the agriculture sector is quite significant in providing new findings in terms of what works for Kenya. And this will play a crucial part in also improving productivity and in turn also affect the prices of food. So the better research that is done to give the farmers in Kenya on what works and what should be done to improve food security will also have the positive impact of reducing food prices and also reducing food poverty. So the second proposal was the provision of incentives for post-harvest handling practices. So especially when it comes to exports, there are conditions that are set that farmers have to meet for them to be able to export their products to specific countries. So practices like the cooling, disinfecting, packaging. So this will also play a role in helping Kenyan farmers understand what is required at the international level and be able to invest in especially the coolers, which are quite expensive. So the agriculture sector can help farmers acquire those cooling machines, information on how to disinfect and package the products for sale and also for export. Also, the agriculture sector is devolved in Kenya. So the national government mostly does formulation of policies. So county governments in devolution started in 2013. So it's been roughly 7 years for counties to adjust and adopt mechanisms on what works within each county. So since after every 5 years, we have new officials within the county government. So it is important to give them the continuous support on understanding the agriculture center in the country and how each of the counties in Kenya can contribute towards the success of that sector. The next sector was the water, sanitation, and hygiene sector. So during COVID, the necessity for having water, sanitation, and hygiene sector that works was quite evident. And even during post-recovery, this sector will still play a huge role in ensuring that the cases and the spread of COVID-19 is limited. So the first proposal is water and sanitation in schools with the reopening of the economy and also schools resuming. It's important to ensure that the sanitation within schools and the levels of hygiene are maintained to what is required for what is required as a measure against the spread of COVID-19. So that can be, that can be implemented in this budget as students go back to school again in June. The other one again is research and data knowledge data and knowledge management in the sector of WASH. Across all sectors, we can't overemphasize the need for research and development, especially as we aim towards Vision 2030, multiple monitoring in between to see what works and what doesn't work. So research will be key in informing what has been achieved so far and what needs to be done to cover the miles. The third proposal in this sector was to strengthen the institutional capacity and also community initiatives with regards to water resource management. In Kenya, when it rains, there's a lot of water and there is flood. So it is important to inform and invest more in methods of harvesting water that works not only just at the national level, but also at the community level within households, and also flood control so that all the water that goes to waste when it rains can actually be harvested for better use during the dry season. So the next sector was the education sector, and the main proposal here was increased funding within the sector, especially with the COVID-19 disruptions and the few adjustments in terms of classroom arrangements, learning online, especially with everyone was unprepared for the pandemic, and there was quick adjustment towards provision of education to learners through Zoom and radio services and television services. So the first area that is proposed for increased in funding is the Ministry of Education strategy on the integration of ICT in education. So we have the national ICT policy that aims to make Kenya a knowledge-based economy and also facilitate the use of ICT in providing education in Kenya. So there was the Ministry of Education strategy had highlighted how they will put in place measures to ensure that educational institutions and teachers and learners are provided full ICT infrastructure, and also policies will be enforced around ensuring that ICT in education is a success. During COVID, we've seen the challenges that still exist within provision of education through ICT. And so it is important to see what was their strategy, what has been achieved this far, and what needs to be done to ensure that we achieve the vision of.
Yes, I can.
Yeah,
no,
so
the
the Ministry of Education should review the strategy to see, especially in the wake of COVID-19, where most of our loopholes were exposed, and we were able to see where the challenges lie. So they should review that strategy and put it in line with the current situation. The second proposal feeds into the first proposal. So as long as we have teachers who don't understand how ICT works, they won't be able to effectively provide that information to learners. So since this was still part of Ministry of Education strategy to equip teachers with the appropriate skills and the competencies required to offer these services to students. So that also needs to be reviewed. As we saw during COVID, most teachers couldn't even use those Zoom services, Microsoft Teams, to be able to teach learners via those means. And the third proposal is a multi-sectoral committee to also work on a long-term plan to bridge the digital divide. So most of the recommendations in the education sector this year focuses on ICT, because with COVID and the uncertainty of whether the COVID cases will reduce and normal school programming will resume, it is important to bear in mind and have a plan for if things don't go back to normal, that learners can continue learning within the institutions. So we saw that even the divide between the private and the public schools, and also the divide amongst the public school also. So it's important to come up with a plan that works in reducing these gaps that exist, so that learners in all schools across the country get to receive the same quality of education and efficiently in the same way. The other sector is the health sector. So again, the health sector is still another crucial sector as we deal with this pandemic and also planning for post-recovery after the pandemic. So the proposals are to strengthen primary care and community health. The budget, the 2021 budget also focuses on upskilling the health sector in provision of services, especially during COVID-19. So most of these proposals shared by the public already fits into what is on paper in the proposed budget. So hopefully, once implementation, these proposals will have been taken care of. So under the universal health coverage scheme that Kenya is planning, the pilot phase has been done in 4 counties, and the plans are to now upscale to cover the rest of the country in the next over the coming years. So since the goals of the universal health coverage scheme are very similar to these proposals given, by strengthening primary health care and also recruitment of healthcare workers and community health volunteers, and also to increase the financial investments into mental health services. So these proposals are quite similar to the goals that Kenya has set under achieving universal health coverage. So the commitment to universal health coverage scheme will in turn show the commitment of the government to these proposals. And in terms of mental health, this has been something that has not been incorporated into the budgets over the other years, but the pandemic has shown the need for the general well-being, not just the physical, but also the mental health aspect. So moving forward, and especially as people recover from the effects of the pandemic, a lot of mental health services will be required. So budgeting for this to ensure that the supply is in line with the demand that will arise as a result of COVID-19 will be great for the country. So far, the proposals that I have discussed are proposals that relate to the expenditure side of the budget, but also there are proposals for the taxation side, because we have to raise the funds so as to be able to spend the funds. So there are also proposals in how to ensure that our tax collection can also match with the expenditures that we highlight in the budgets. So there's the import declaration fee and the railway development levy. So these are fees that are charged on imports. So the import declaration fee was first stated at 2%, but in the Finance Act of 2019, it was adjusted to 3.5%, and the railway development levy was adjusted from 1.5% to 2%. So the logic and the reason given by the government for adjustment of these fees on the value of imports is aimed at pushing local manufacturers against competition from imports from other countries, with the aim of encouraging the growth of the local manufacturing sector. But as the theory of trade has, that protectionism doesn't really help a country, because it makes Kenya be comfortable and not try to match up its innovation. towards what is expected internationally. So as much as these levies are put in place, they should be balanced to ensure that they actually serve the purpose they're set for, and with the aim of cushioning the local sectors, we shouldn't run the expense of having shortness in supply of certain products, or having to access them at a higher price compared to if imports were allowed into the country at a much lesser fee. So the first proposal under the import declaration fee and railway development levy is to remove IDF for all industrial inputs, the basic raw materials and intermediate inputs, and also industrial machinery and spare parts for manufacturers. So when these fees are put, they make the costs of these products higher. So removing them will help people in those sectors that require heavy machinery be able to access them at a better price, and also reducing the railway development levy to 1%. So that is also hoped to have the same effect as reducing the IDF. And finally, request for refund of excess import declaration fee and railway development levy because of the as a result of the system not being in place when the Finance Act of 2019 was implemented. So refund is tax refunds are reimbursements that are made when someone pays maybe more than what they were expected to pay, when they pay more than the liability they had in tax. So it will increase an organization or a corporate's flow within, so making it quick to refund such excess costs that companies incurred will help also with their liquidity. So that's why there's that proposal. So the overall expected outcome of all the proposals under this taxation proposal one is to actually increase competitiveness in the domestic market, and also to create jobs, encourage import substitution, and also save foreign exchange. The other proposals are with regards to the value added tax and the excise refunds. So the first proposal is to increase the monthly budgetary allocations to about 5.5 billion. So what happened is when people require tax refunds, sometimes there is the willingness to give back the tax refunds, but there is no budgetary allocation towards that. So increasing the budgetary allocation will also go a long way in feeding into the second proposal of the one-off payment to clear outstanding VAT and also the excise tax refund. KRA promises that on their website and also in their guidelines that as long as a claim to request for a tax refund is fully supported with all the necessary documents, that they will process that request within a period of 3 months. But we know that's not always the case. So fast tracking of paying all the outstanding VAT again will also have the positive outcome of increasing the cash amongst businesses, so improving their liquidity and also helping them run costs within the company. And also the paying of these refunds on time will also ensure that there's circulation of funds and they are moving promptly, and this eventually will also act as a catalyst to economic activities within the country. In conclusion, one of the proposals given by Raphael was also to roll out an economic stimulus program. We saw the economic stimulus, the 8-point economic stimulus program that was launched in May to help the economy curb the effects of COVID-19. So it is important that we the programs targeted under economic stimulus are ones that catalyze economic activity. So especially at a time when there are job losses and most people are struggling to make a living, targeting programs that ensure that there is cash flow within the economy instead of investing in infrastructure and energy, things that don't necessarily put money in everyone's pocket or increase cash flow and circulation of funds within the economy. So rolling out of an economic stimulus program that also directly targets at ensuring that there is circulation of money in the market will be important, especially trying to recover from COVID-19. And also the other recommendation is to increase the advocacy for National Treasury to set realistic revenue targets. So year on year, we set a budget and then we also project what we expect to collect in terms of revenue. So what happens when there is an unrealistic revenue targets? We set way above what we are actually capable of collecting, and then the consequence is that we actually plan our budget around an unrealistic revenue target. So that increases the deficits that we have within our budgets as the revenue shortfall occurs. So, and since most of the times we don't adjust our expenditure, then that means more borrowing to actually feed into the gaps that we have within our budget. So the National Treasury should set a realistic target so that as we budget for the next year, that the projection of the revenue that is expected to be available is quite close to what we will actually manage to collect. And also the other point is also feeds into the realistic setting of targets, is also strengthening the macro fiscal framework and revenue forecasting capacity. So the National Treasury uses a model to predict the revenue that we hope to collect and at the growth at which Kenya will grow over the coming years. So if the challenges exist within the model, maybe this is the time to address it, because we've gotten it wrong consecutively over the last 5 years in terms of our revenue forecast. So, and that keeps on adding to the budget deficit. So if the challenges in revenue forecasting is within the model itself, maybe it's time for National Treasury also to strengthen its model to ensure that the projections are close to the true value. The last point is to improve efficiency, effectiveness, and transparency, and also accountability of public spending. There was a lot of debate about the Kenya IMF program. So that is a good opportunity because there are commitments within the program as highlighted and is available on IEA website. So there are commitments that Kenya has set, and amongst them is also ensuring transparency in public spending and also restructuring our expenditure. So this proposal still feeds into Kenya's commitment with IMF over the next 38 months. So as long as we stick to the policies that are written and ensure they are all implemented, I think we will be good to go, especially with all the uncertainties about the future with COVID-19. It is important that we stick to all the reforms and the commitments that we have made. Thank you so much.
Thanks a lot, Darmi, and of course, Raphael, for sharing some of the highlights captured in our citizen alternative budget for 2021. So just to reiterate, this memo is the idea of the citizen alternative budget is basically to provide the public or different civil society organizations an opportunity to be able to engage and influence the budget. And so, as I mentioned, we've been doing this for a number of years now, over 20 years. And so the idea of this citizen alternative budget, or the memo that was presented, we presented this in early March, is through pre-budget hearings, is for these different stakeholders to share their presentations, and then for us to synthesize them collectively and submit them to Treasury for them to consider in terms of influencing the budget. So that's the whole objective of this citizen alternative budget. And the reason we are doing this now is in anticipation of preparation of different, whether it's organizations or individuals, as they'll be reviewing the budget that was tabled in Parliament last week, just to be able to compare whether, to check whether some of the things that they mentioned or that were captured in the citizen alternative budget are factored in the proposed budget estimates, and also provide them with that. There's another opportunity before the budget is approved by the National Assembly. Anytime around within this month of May, we still have another opportunity in which any individual or civil society organizations can share whatever views they have with the National Assembly for them to consider in adjusting the budget before it is approved. So that was one of the other objective of this, just to create the buzz around the anticipation in reviewing and engaging during the public hearings that will be announced soon by the National Assembly. And as I had mentioned, the IEA will also be, I think early towards the end of next week, we'll sit and have a retreat to basically review the budget. And we'll also have a launch and invite you as well to just share some of the highlights of what the budget means to the different social groups and the like. So we'll be sharing that, we'll be publicizing and mentioning when this will be coming up. So be on the lookout of that through our different social media platforms. So having said that, I would now like to pause and just invite our participants. If you have any questions or comment, you can either raise your arm or just unmute yourself and share your comment or question, or post them in the chat box. So far, what I see is from Howard. So let me quickly read this as you guys are warming up, as our participants are warming up to share or ask whatever question that you may have. So there are three things. We have two questions from, I think they are comments or questions from Howard. Now the first one is, I think it's a comment, is in regard to the education sector. So what Howard is saying is that integration of ICT in the education depends to a large extent on expansion of power grid to all parts of the country. So what he's saying is that alternates such as solar, wind power could provide, could be good alternatives to that through taxation. And so therefore, through taxation makes these options more affordable or relatively less expensive. So what he's saying that could we have specific recommendations for this as options to electricity? And given that the financial distress at the Kenya Power, is it time to privatize and allow competition or restructure it? So I hope Raphael and Darmi, you can prepare, you can note that, take note of that. So there's a second one from Howard. So we'll have a first round and then we'll go to another, a second round of questions. questions, Q&A. So the other comment or question from Howard is actually in relation to the health sector, and what he's saying is that the UHC pilot was not a runaway success, with Nyeri eventually abandoning it due to financial distress. Legal reforms to align NHIF to UHC have been slow. Universal health coverage have been slow. So there are questions around the delays in those reforms towards alignment of NHIF to UHC. And then the other point that he notes is that currently, as a result of this, currently people in the informal sector still have problems contributing to and accessing NHIF services. A number are reportedly told to pay up 6 months subscription in advance. Again, I hope, Darmi, you've captured that. Then from Andrea. So the question from Andrea is basically asking us how successful we are in having our taxation, our proposals taken up by Treasury. So Raphael, you can respond to that. Then we have another question from Collins, again in relation to the health sector. So what Collins is asking is, how do we shift health budget from curative to preventive, and does its budget allocations get into research institutes such as KEMRI? Is this allocation in line with the margin needs? So Darmi, either Darmi or Raphael, you can note that as well. Do you have any final questions before I invite Raphael and Darmi to respond to this? Okay, if not, Raphael, do you want to go first? Would you like to go first?
Yes, John. I think thank you for the questions. I think I'll start. The first one I would like to respond to is the one from Andrea on perhaps how successful we have been in terms of our proposals being taken up by the National Treasury. And I think one of the things that John has mentioned is that we have been sharing with the National Treasury over 20 years the alternative budget, meaning that they recognize our input as an institution. And therefore, one of the things that happen is that each and every year, I think the National Treasury normally request our alternative budget. Actually, last year, I remember they actually responded by telling us that yes, we have received your alternative budget, and some of the issues that you shared were expenditure oriented and tax oriented, and they will see to what extent they can be able to pick. However, over the last 3 years, we have seen some of our particular taxation proposals being picked up. For example, I remember they picked a proposal, and they invited us so that we can have a discussion with the National Treasury, the Director of Budget, having a discussion around the IDF, reduction of IDF fee to align it within the East African community. So that one was picked. So in terms of trying to explain how successful, the only way we can be able to say we are successful is actually looking at what is contained, particularly by the taxation measures, vis-a-vis what we shared from the alternative budget. Although we cannot be able to attribute 100% to what is contained in the perhaps the taxation measures, we have seen over the years that the National Treasury has been picking some of the proposals that we share with the National Treasury. Now, with respect to Howard, you ask the question of people in informal sector having problems on an HIF and mentioning that they are told to pay up to 6 months. I think most people to be honest, most people in the informal sector, what happened is that they have got this wait and see game. whenever you have problems, that is the time you realize that you need actually National Hospital Insurance Fund. And what happened is that the NHIF have got its own rules and procedures. And one of the thing, I think, one of the rules is that if you have not paid for example, a year or 2 years, and you want to come back, perhaps you're not feeling well and you want to be catered for, what happens is that NHIF request you to pay up to 6 months before you can be able to access. And therefore, my thinking is that what NHIF is doing to try to bring more people to the coverage so that we can have the universal health care. The other aspect is you ask is about integration of ICT in the education sector, and you pose the challenge of power connection. Yes, I agree with you in terms of that challenge, and yes, we need to have alternatives so that we can be able to ensure that our schools, the infrastructure of our schools are improved. And I wouldn't specifically mention or give a recommendation as to an option. The other aspect is it time to prioritize. I think it is important that Kenya Power and Lighting Company have had so many years of monopoly. I wouldn't say it is the time, but I think it will be proper to have a competition where we have other companies. But the challenge will be how do other companies again access to the grid, given that Kenya Power and Lighting Company have got most of the infrastructure in terms of grid within the country. I think I'll be able to I have quickly responded to those issues, concerns. You have
yes. Thanks, Raphael. Darmi, do you want to pick to respond to any of the questions?
Thank you, John.
Yeah.
In addition to Raphael's explanations and feedback, with the question on is it time to privatize KPLC, it is true that most of these state-owned enterprises are a huge source of financial risk to the country. I think the answer to that will be yes, it is time to actually restructure. Because most of these organizations, it's not really a lack of revenue problem. It is more of a spending problem. So it is time to actually restructure all the state-owned enterprises so that they stop being a source of liability to our strained budget. With regards to the universal health coverage, yes, one of the challenges that we also note is the lack of a report on the findings from the pilot. So there isn't really an assessment given that has informed the rollout of project to the rest of the country. So yes, it has its own challenges, but that doesn't mean we abandon it altogether, but try to fix those challenges in between, because achieving that universal health coverage is important so that everyone in Kenya has the ability to access. And for people in the informal sector, I noticed in one of their fundamental pillars under the UHC, the plan is to actually set aside funds that will cover middle, mostly low-income households. So by biometrically registering, so it is hoped that this will also help people in informal sector and also from low income to be able to access the services. But I agree, Howard, there are challenges within, but yes, but the goals are still something that we aim to achieve, and it will be good for the betterment of the health services in the country. So, and what was the other question? Yeah, I think we've responded to the first round of the questions.
Yeah, thanks, Darmi. Maybe just to add to what Raphael mentioned in response to Andrea's question. So the first thing is that in terms of the extent to which our proposals have been incorporated or taken up by the National Treasury. So first, just to mention that the citizen alternative budget, or the idea of trying to influence the budget, is the idea is basically to make compelling case of the reason why we are proposing certain things, based by and to provide evidence for that and justification for that. Yeah, so to back up whatever it is that we are saying. So that's the idea. And of course, the National Treasury is not necessarily, is not compelled, it's not under any obligation to pick those proposals. But the idea is to push and to make that compelling case, to also work together with different organizations in order to push for certain things. Because no doubt when the National Treasury receives certain proposals, maybe from different groups, they will realize that indeed this is something that is of importance to Kenyans, or something that they need to think about. So I just wanted to mention that. Now, the second thing is that what we do is, given that there is no feedback mechanism, so generally Treasury says that yes, we received proposals from different organizations and from different individuals, etc. So that provision for people to give their proposals is provided for, but the feedback mechanism is not in details in terms of the stuff that we received. This is what we have incorporated, and these are the reasons why we've incorporated this and left these other things. So that feedback mechanism is not provided for. Now, so what that means is that for IEA, normally we would do our own estimation and assessment of what we this assessment is basically we compare our alternative budget with the budget, and we'll be doing that, as I mentioned, next week. And again, we cannot say with certainty that the proposals we had and something that was in the alternative budget and was captured, we cannot say with certainty that it was only from us. Other organizations may have done this. But we do our own estimation, and from this estimation, about 15 to 30% of our proposals are often taken up by Treasury. So the number, the percentage actually varies from that. And in some years, it could be as much as 25, and some years about 20, around 20%. So that's the range. Now, just to give you an example, for instance, we had this proposal about expanding the tax bracket, pay-as-you-want tax bracket, I think for 3 consecutive years, and this was actually taken up. And I know, of course, there were also other organizations that were pushing for that. This was actually taken up, I think, in either 2017, 18, or 2018, the very first time. But this is something that we had been proposing 3 years before. So sometimes some of the proposals that we may have shared 2 or 3 years ago may end up being picked up or taken up 2 years or 3 years, or sometimes even 4 years or later. So that's the process that usually takes place. And there are a couple of other examples that we can share of proposals that have been taken up by Treasury, based on also some direct engagement with the National Treasury, especially some taxation proposals. There is what also that Raphael mentioned. So I think we'll open it up now for the second round of questions. And in case maybe any of the questions have not been responded to, please let us know. So there's a question from Collins. So Collins is asking, I think there are 2 from Collins, let me see. Actually 3. So the first one from Collins is so I mentioned this, how do we shift health budget from curative to preventive? And does the budget allocation get into research institutes such as KEMRI? Is this allocation in line with emerging needs? So Raphael and Darmi, please take note of that. And the second one from Collins, what he notes is that with a large amount of NHIF spending going to private hospitals, is it feasible to model UHC around it? And the third one from Collins is asking what our take is on adoption of differentiated unit cost funding for universities. Raphael, please take note of that. Then from Howard, speaking of privatization, should the state be pumping funds into private company KQ? What impact will there be on our economy if we let KQ find its own equilibrium in the market without state intervention? Is a national airline a necessity? Then the last one in the chat box is from, the last question is from Lynette. What support, so what she's asking is what support can be accorded to county governments under the agricultural sector to enable them improve their budget allocation to ensure food security? So let's start. Can we start with Darmi, and then Raphael, you can respond to any of the questions that may not have been touched by, that will not be touched by Darmi. So Darmi, do you want to go first?
Thank you, John.
Yes.
Okay. In response to Colin's question on is it feasible to model the universal health coverage scheme around the private hospital, I think not, because the model and the plan for universal health coverage is to target the public health facilities. So I don't think there's a feasible way of including, because the plan was for example, at county health facilities and also the county referral hospital. When someone visits the hospital, they don't pay for the user fee, and then the government now compensates those hospitals by giving them the funds that they've forgone in treating patients. So the model has been planned around the public health facilities. So in response to that, I think not. And in terms of privatization, you asked the question that is it right for the government to pump funds? It is not, but we understand that the budget process is also a political process, and that where the interest of the budget of the policymakers lie, as much as most of the time it might not make sense to us economically, it might be of political interest to continue funding. So yes, it does not make sense economically to continue funding a failing company. But as stated earlier, Kenya has promised to actually do a lot of structural reforms within the state-owned enterprises, including Kenya Airways, KPA, KQ. So yes, it is hoped that that will actually make them stay in line of the expenditure and not year funding from the national government to bail them out from financial crisis. Okay, with regards to the question on how to shift the health budget from curative to preventative, I think again that's also a journey, because as laid out also under the universal health coverage, the counties that were selected were also selected for different reasons. So for example, like Machakos was selected as a pilot because of the high number of cases, and Nyeri was due to the high cases of communicable diseases. So I think the foundation of choosing the pilot counties with different health needs is actually a way of trying to address also the preventive measure, for example, in areas where there are communicable diseases, how to prevent them, and also now the curative one for places like now that has high number of accidents, now also to offer the curative the curative form of service. So I think that that incorporates almost all aspects of both preventative and also curative. And yes, that's it.
Yeah, thanks, Darmi. Raphael?
Yeah, thank you, Dalmi. I think you have answered most of the questions, but let me pick from where you have where you have left in terms of how can we be able to shift budgetary allocations for the health sector from curative to preventive. I think two things. One is that there is need for engagement, particularly by the various stakeholders, either at the county level or even the national level, when it comes to the issue of budgeting. I think at the sector level, when we have sector discussing in terms of allocating resources to whichever programs, then I think that is the most appropriate time where we can have a discussion, particularly by the technical guys, on where do we need to allocate resources more. Number two is a question of advocacy. We as CSOs and we as the various stakeholders, how do we advocate more? Because I remember most of the proposals that used to come like 3 years ago from various stakeholders was the question of how do we ensure that resources with respect to curative are more than focusing, how do we make sure that we create a balance between allocating resources between curative and preventive. The other question from Collins again is questioning about the amount of NHIF that is paid to private sectors, and I don't know how I would be able to. I don't know where this information is from, because we have not actually conducted a study to find out in terms of who benefits, who get more money, or in terms of people who normally get the hospital. Is it the public, is it the private, or is it the public? And I believe my understanding or my take, and this is my view, is that from my take is that public hospitals, I think they are the ones who depend more on NHIF, because when you go to private hospital, and most of the time they pay on for bed only. But I think we need to conduct an analytical analysis to find out who actually benefits more in terms of having an insurance under NHIF. The other question is by Renette Joroge, and you're asking about what support can be according to county government you're focusing on agriculture sector to ensure there is food security. Now, I think agriculture sector is a devolved function, and if we want to achieve food security, then I think more resources by the county government need to be very, very targeted. For example, we need to ensure that the extension, most county government and do not have extension officers the way we used to previously have extension officer. So we need funding so that the right issues with respect to agriculture are being addressed. And then there was another question about our take on the adoption of differentiated unit cost funding for universities. That one I would say yes, in terms of do we have differentiated funding? And the reason why I would say this is that different universities have got different things that they do within. For example, I would pick like Egerton University, which is an agriculture based, which actually have got other activities other than training students. So in terms of making sure that institutions can be able to take up other things where they are able to generate revenue, for me it will be a good thing, and cost funding differentiation from the universities would be a good thing from my end. Thank you.
Yeah, thanks, Raphael and Darmi. I think just to add some general comments based on the questions that we have received. The first one, Sorry, the one on shifting of budgets from curative to preventive. Now, again, just to reiterate, the idea of this budget analysis basically, or presenting some proposals, is we try as much as possible to use evidence in terms of supporting the proposals that we present. Now, for instance, in the past, we did some, I think in the early 2010, 2011, thereabout, we did a study on to look at where the incidence of spending falls, both in education and in health. So it's a question on around equity in spending. Now, in that, what that study showed is that spending in the health sector, especially in relation to health facilities, of course, then we didn't have we had I mean we did it just before we got into devolution. We did that study just before we got into, but again, what the study showed is that spending at the lower primary health facility level, that's your level 1, your level 2, basically at the health dispensaries, clinics and the like, benefits the different income groups more equitably than spending at the tertiary level. So what that means is that at the tertiary level is basically spending at the referral hospitals and the like. Now, as much as the unit cost is obviously higher then, in order to ensure that what government spends is benefiting the different social groups, and in particular the poor, there is need to shift that spending more at the lower primary health facility level. It is more equitable in that sense, and you have more people benefiting at equitably at that level, and that actually in a way speaks to the issue of need to progressively shift our spending from curative to preventive. So we use that. We've actually engaged the Ministry of Health and other health officers on the same, based on our evidence. So that is just to respond and to respond to Collins and to add to what Raphael had mentioned. Was it Darmi had mentioned in regard to Collins' question? And then there are general things around bailouts and issues of rationalization of parastatals. So of course we have a challenge in terms of revenue collection, yet there's a lot of money spending or transfers towards parastatals. Some parastatals are actually commercially viable. So we've actually engaged even in the past about the need to wean these parastatals off transfers, but also the need for the government to rationalize and implement the report. There was a report that was prepared around the issue of rationalizing parastatals, and it speaks to some of the questions that have been posed, whether it's KQ and the like, and some of the other parastatals, especially those that are agriculture related, that have been, we've had calls about bailing them out. These tend to be politically driven, but they do not make economic sense. And so some of the engagement and proposals that we presented in the past are about the need to rationalize those parastatals. I think those are the only two things, general comments that I wanted to make. Of course, the last one in regard to support to counties. So in a devolved system of government, I mean, the idea of this is theoretically that budgeting should be informed by the plans that whether national government or the counties prepare, and there's need to, these plans should actually be informed by priorities of citizens and the needs of citizens. And so So at the county level, of course, county governments are independent in terms of preparing their own budgets and in the way they want to spend. But of course, the county integrated development plans they come up with should be aligned to the national plans, and the public theoretically should ensure that they participate in terms of influencing the plans that whether counties, the plans that are developed at the national level, the national and the county level, and in turn that the budget should be informed by those plans. So from a theoretical perspective, if that theoretically if that is done increasingly and spending is or budget implementation is done effectively and prudently with little waste, then obviously that would lead to improved service delivery and address the issue of food security. And so the idea is just basically for us as citizens to continue to engage and raise questions around whether indeed these budgets are aligned to our plans, and try and raise questions around all our different government officers to account on the issue of aligning those spending or allocation first, and then in turn spending to our plans, and also engaging with the legislator to raise questions and just oversight public spending. Increasingly, that will reduce misappropriation of funds and ultimately lead to improved service delivery, and in turn, of course, better outcomes, whether it's in terms of food security, whether it's in terms of health and the like. So that's the idea of engaging in the entire this budgeting process, right from formulation, in terms of influencing those allocations, as well as keeping an eye on the way the budget is being implemented and whether its implementation is in line with the approved budget. So thanks. I do not see any other questions in the chat box. So what I will do is basically invite Raphael and Darmi to make their final remarks, and to also let us know where we move from our next steps going forward. So let's start with Darmi and then Raphael.
Okay, thank you, John. First, I would like to thank everyone who made time today to join this webinar, and also to all the organizations that submitted their budget proposals to IEA. And it is our hope that the proposals given will be reflected in the budget and that the citizens' voice will be heard. Thank you so much.
Thank you, Darmi. Raphael?
Yes, I would also like to take this opportunity to thank all the presenters who made the social and the corporate sector budget proposals. And one of the things I also wanted to mention is that let's continue doing the same and engaging with the National Treasury so that we see whether we can see some of our proposals which are concrete and evidence-based picked by the National Treasury so that we can see change in terms of budget implementation. The other thing is what John has mentioned about what we normally do to question, putting questions around the spending and whether we are able to engage with our registrators in terms of what they are supposed to do, that is representation, oversight, and registration. So I would like to encourage all of us to be engaging with particularly our legislators so that most of our issues can be picked. Thank you.
Thanks, Raphael and Darmi, and of course to our participants for making time to join us in this launch of the Citizen Alternative Budget. So it was posted I think a month or so ago, on our website. So feel free to interact with it. You can download it from our website as well as the presentation, and just go through it. And as I mentioned, we will next week, towards the end of the next week, we'll sit and scrutinize. I mean, basically review the budget estimates that were presented last week. And of course, we usually come up with what we call a budget memo, and we will obviously invite you again just to share our analysis of this budget, noting that we still have another opportunity to share some of the views that we have in regard to the budget, whether in whatever sector. We still have that opportunity. The public sector hearings, I'm sure those will be publicized or advertised in our local dailies, and I think on telly soon. So look out for that. If you have your own proposals that you'd like to share with the budget committee or any departmental committee of the National Assembly, so you still have that opportunity, because I saw some of the comments that were mentioned with regard to some things, some views that, whether it's as an individual or as an institution, that you'd like to share, and this you can share directly with the budget committee. So again, thank you, and please look out for our advert or our banner for the post-budget forum. We haven't set a date, but we should be doing that by, I think Monday we'll already have set a date, so please look out for it. We'll post it on our website as well as on all our social media platforms. So again, thank you, and have yourself a good Friday and nice weekend ahead. Bye-bye.
Thank you, John.
Bye. Thank you.